really fundamental for, well, anyone studying medicine, particularly our listeners in India following KMR advice. We're talking about loop diuretics.
That's right, and we want this to feel a bit like one of those lecture discussions you'd find on KMR advice. Very focused, step by step.
Exactly. We'll break down how these medications work, their effects, the risks, and hey, if you find this useful over on YouTube, please do share it, subscribe to KMR Advise, maybe hit that bell icon too, because understanding this mechanism is, well, it's key.
Absolutely essential. And for today's deep dive, we're drawing from excerpts on the loop diuretic mechanism and effects. We'll stick just to that information.
Okay, so our mission, pretty clear. Explain how loop diuretics work, their main effects, and the significant risks involved. Let's jump in. Step one, the drug gets into the patient.
Right, so drugs like furosemide or torsemide, common loop diuretics, they're administered maybe orally or IV.
And then they're in the bloodstream. Where are they headed? What's the target?
They circulate until they reach the kidneys. Specifically, their site of action is a part called the thick ascending limb. It's part of the loop of Henle.
The thick ascending limb. Okay, so they've arrived. What do they do there?
Well, in the membrane of the cells lining this tubule, there's a special protein. It's called the Nau2-2Cl cotransporter. Think of it like a revolving door.
A transporter protein. What does it normally transport?
Its job is to move sodium, Nau, potassium, Ko, and 2 chloride ions, 2Cl, from the fluid inside the tubule back into the kidney tissue and eventually back into the blood. It reabsorbs them.
Okay, reabsorption. So the loop diuretic interferes with that.
Precisely. The drug molecule essentially blocks this cotransporter. It inhibits its action.
It jams the revolving door, so to speak.
You could put it that way, yes. So what happens, those electrolytes, the sodium, potassium, chloride, they can't get reabsorbed as efficiently.
So fewer electrolytes are moving back into the body.
Significantly fewer. They remain trapped inside the kidney tubule in the fluid that's on its way to becoming urine.
Okay, so now you have more of these dissolved particles, these electrolytes, stuck in the tubular fluid. How does that affect water?
Well, that leads directly to the next step. Water tends to follow solutes, right?
Yeah.
Basic osmosis.
Right.
So with this higher concentration of electrolytes remaining in the tubule, water is osmotically drawn into the tubule, or rather, it's prevented from being reabsorbed back into the body along with the electrolytes. More water stays in the tubule.
So more electrolytes stay in, more water stays in. That sounds like it leads directly to more urine.
Exactly. That's the diuretic effect. You get a significant increase in the excretion of sodium, potassium, chloride, and also, importantly, calcium and magnesium are affected too, plus all that extra water.
And this effect is quite potent.
Very potent. That's why we call it high-ceiling diuresis. These drugs can produce a much greater diuretic effect, a higher ceiling, compared to some other types of diuretics.
High ceiling. Got it. And do they work quickly?
Yes, that's another characteristic. Loop diuretics generally have a rapid onset of action. You see the effects relatively quickly after administration.
Powerful and fast-acting.
Right.
But that kind of potency must come with some potential downsides, some risks.
Absolutely. And it's crucial to understand these because you're losing so much potassium. Hypokalemia, or low potassium levels in the blood, is a major concern.
Okay, low potassium. What else?
Well, losing all that fluid can lead to volume depletion, basically, dehydration. And another potential risk, though perhaps less common, is ototoxicity.
Ototoxicity. Damage to hearing.
Yes, potential damage to hearing or balance. It's something to be aware of, especially with high doses or rapid infusion.
Low potassium, dehydration, potential hearing issues. These are serious.
So how does this impact patient care? What needs to be done?
It means monitoring is absolutely essential. Anyone on loop diuretics needs close monitoring of their electrolyte levels, especially potassium, and also their kidney function and fluid status. Regular blood tests are key. Makes sense. Okay, let's do a quick recap, maybe especially for the students tuning in via KMR advice. Drug is given, goes to the thick ascending limb in the kidney.
It blocks that Nau2Cl cotransporter.
Which means less sodium, potassium, chloride get reabsorbed back into the blood.
Right. They stay in the tubule, pulling water with them through osmosis.
Leading to increased excretion of electrolytes in water, that powerful high ceiling effect.
But carrying risks like hypokalemia, volume depletion, and ototoxicity.
Which makes close monitoring vital.
Exactly. Understanding that whole chain of events from the transporter block to the clinical effects and risks is fundamental. As we often stress on KMR Advise, knowing the why behind the what is crucial for good medical practice in India and everywhere.
Absolutely. So here's something to think about as we wrap up. Consider how those electrolyte imbalances we talked about, especially the low potassium, might actually look in different types of patients.
Hmm.
What signs, what symptoms would you, as a healthcare professional, need to be really watchful for? It makes you think about how one targeted action ripples through the whole system.
A very important point to ponder.
And for more deep dives into medical concepts like this, do check out KMR Advice. Don't forget to like, share, and subscribe over there. Thanks for joining us.